Hello, good afternoon. I am Agis Tsouros, and I'm really delighted to be able to connect with you all and share with you my experience and ideas about healthy cities, about urban health, how to promote health, well-being, equity, and sustainable development in cities. Perhaps I should say a few words about me. I'm a public health physician. I have had the privilege to start working for WHO at the end of the 1980s, and my first assignment was to begin to develop a new project at that time, which was called Healthy Cities. It was quite unique by any means because it was an initiative that did three things. First, it recognized the importance of local action, the importance of working in urban settings, and also, most importantly, the importance of the role of local governments, of mayors, of city councils in the promotion of health. Most UN organizations, like the WHO, are basically organizations that work normally with national governments. But this was the unique opportunity to begin to build links with city leaders. Why? Because, as we all know, most of the determinants of health, and since those days the evidence has accumulated very rapidly, are actually related to what cities do to create the living and working conditions for people. Transport, education, social services, health services, environment, a wide range of sectors are actually creating the circumstances which affect directly or indirectly our health. So it was felt that it was appropriate to work directly with leaders of cities who had closer proximity with communities, which is very important, and at the same time they could command, they could be conveners of intersectoral partnerships. Before I will have the opportunity to answer your questions and have a dialogue with you, I want to say that Healthy Cities is a project, an initiative, which is today a global movement. Everywhere in the world there are healthy cities, thousands of them, emerged from an era that marked the beginning of the new public health. It was when the World Health Organization in the early 80s launched the Health for All, and later, as you probably know, the famous Charter for Health Promotion, the Ottawa Charter. It was an era when we started talking about equity, the importance of addressing inequalities, the importance of involving communities in health development, the importance of developing platforms where ownership for health and development will be something that should not happen in a top-down way, but in a both top-down and bottom-up, engaging both the leaders and the representatives of various community groups. Please submit your questions during the talk, and perhaps I could pick the first question that I see on the monitor. That I stated in a talk yesterday that modern approaches to public health challenges in the 21st century require a whole of government approach, and that the health sector alone cannot do it. This is a great question, because I would like to perhaps explain that for so many years, and many people continue to think that health is only the absence of illness, the absence of disease. And yet, the earliest comprehensive definition of health in the 1948 Constitution of the WHO talks about social and mental well-being, which goes way beyond hospitals and nurses and health sector establishments. But in more recent years, there has been a revolution in our understanding of where health is created. And the literature, to start with, on the social determinants of health, then on the environmental determinants of health, the commercial and the cultural determinants of health, have given us a wealth of information which is making a very strong case that yes, the health sector has an important role in making sure that health services have the appropriate quality, sensitivity to our needs, they are accessible and affordable to us, but basically health is everybody's business. And everybody's business means that other sectors should be aware that health can contribute to achieving their goals, but also that they, with their activities, can have a negative or a positive effect on health. So let's take some examples of modern approaches in public health today. We talk about equity and inequalities. If you ask me, I would say that probably one of the most noble and important objectives of a healthy city today is to create a city for all the citizens. To be aware, to measure the differences in life expectancy, in experiences in disease, in living or working conditions that is experienced across the territory of a city, and do something about it. In addressing inequalities and the causes of the causes, as we say, what is it behind those inequalities, whether social, environmental, and other factors, it requires a cooperation between different sectors. And this cannot happen by the health sector alone. A health sector alone can be a very strong advocate to other sectors, but it is not enough, because it's a power balance within a city or within a national government. It will have to be the goal of the whole of local government. It will have to be the mayor and the city council who will create the conditions, the circumstances for different stakeholders to sit around the table, to think about health, to be accountable for health, to contribute in the achievement of goals that cannot be achieved by one sector alone. Take today the Sustainable Development Goals agenda. I think this is the agenda that legitimizes action at all levels and across governments around the world. It is an agenda about health, sustainability, climate change, poverty, education, everything that defines today the viability of this planet, as well as the quality of life of people who mostly and increasingly work and live in cities. But to address those goals, as I said before, you cannot do it in a siloed way. You have to have the ability, the capacity, the leadership, the governance to create mechanisms that can really fulfill those goals. Let me give you one of them. Achieving a healthy start in life for all our children. This is not about having only good health services. This is about having education, social services, environment, housing. They should all work together with the family at a neighborhood level to create circumstances that will become the assets for a child to be, to achieve and to fulfill their aspirations for life later. So I will come back to this idea of whole of government and whole of society, because this is the essence of modern public health, to be aware of the influences of the environment, of the importance of our policies. And I would like to end this, answer to your question by underlining especially what we know today, that health is a political choice. It is a political choice because leaders have to think what sort of society they want. A mayor should say, I want my city to offer the good opportunities, the good schools, services, roads, healthy neighborhoods, access to greens, not only in one part where the most privileged live, but everywhere. This is the key issue for a healthy city. A healthy city should be a city that does not discriminate, that offers opportunities to all its citizens, and it does something special. It goes out of its way, if you like, to address their special needs. So the second question is, how do you define success when developing a healthy city? Well, a healthy city is not a city that has achieved good marks on all those aspects that I'm describing, but it is a city that is conscious of the importance of health in social, in human development, in sustainable development. Why is it that today health is no longer the topic of discussion in ministries of health? The biggest decisions that affect our health today on our planet, are actually made outside of ministries of health. Health has now been increasingly on the G8 agenda. Many global fora will discuss the big challenges of our planet, from issues of non-communicable diseases, climate change, aging of the population, issues that relate to preparedness and response to various disasters, community resilience, and so on. Health is always there. It is indispensable. I hope one day it will become a performance indicator of the performance of whole of societies, of governments, and of course of cities. So this is the success of a healthy city today, is to be conscious, to be aware of the factors that affect the health of citizens, but not only words. One of the most famous mottos of the health promotion charter is, make the healthy choices the easy choices. Well, take cycling. We will talk a little bit about cycling later. Well, it's easy to say that that cycling is a healthy choice, but it can be a deadly choice if you don't have the cycling lanes or the support by your transport authorities in your city. So choice is not enough to be made on the basis of our knowledge of what is good for us. We talk about healthy eating. Yes, healthy eating is important. Most people know what is good for them, but it has to be affordable. It has to be accessible. It has to be an easy choice. Cities must make the healthy choices the easy choices. And this is, again, something which is part of a new culture. The appreciation that health is a capital, is an asset for the future of the city, for the development, for its prosperity, for its economy, for the well-being of its citizens. So maybe this is also an opportunity to mention some of these new concepts in modern public health that today, as I said before, can only be implemented through an approach to health which demands the presence, the inputs, the cooperation from other disciplines. You really need to find a way to speak the language, to be on the same page with the perspectives from other sectors. I'll give you an example. In Healthy Cities Europe, we started some years ago a dialogue with urban planners. Well, we all have an instinctive understanding of the importance of the built environment, the physical environment, and health. But we cannot assume that health is a value. It is a term that is necessarily used in the context of other professions. And yet, urban planning, which was, by the way, very closely linked to health in the late 1800s, then those two disciplines went their different ways. Today, we know that interventions in the built environment from the neighborhood level, addressing architectural barriers, access to greens, access to various to local shops and various social activities, can have a huge effect on social inclusion and participation. They can affect the direct health of people who live in those places. But it took us about 10 to 15 years working with urban planners to develop a methodology, to develop some standards, to develop a typology of what it is to integrate health in urban planning. And it was not easy. It's never easy when we try to share an understanding with another discipline, with another sector. And this is also my advice. You will read in public health literature, you will come across constantly intersectoral action, health in all policies, and so on. This does not mean that just because you have the evidence from science that other sectors and other disciplines are going to tell you, oh yes, we are ready to change everything we do or prioritize our activities according to your scientific understanding. No, it doesn't happen like that. You need platforms to have dialogue, to to understand where they come from, to develop common agendas. And there is the basis, the capital, to create true intersectoral action, not for one isolated project, but to begin to work in a different way where health, well-being, and sustainable development will be there as a beacon, as a lens to consider all our policies in our cities. How can leaders make sure that interventions to plan healthy cities include the poor and the marginalized? Well, you know, I have discovered that while today every city can be smart, use the right terminology, and everybody will talk about sustainable development, many will talk about equity, many will talk about convivial and inclusive communities. When you look into their plans and you look what they actually do, sometimes you see that they pay lip service to those great concepts. So to address the question about marginalized groups, if you are a leader, you are the mayor, you are a department that looks at the big issues in your city, you have to be aware and to measure those issues that determine the health of your citizens. To develop, as we call it in the Healthy Cities networks in Europe, to develop a health profile of your city. But a health profile not to only include statistics of morbidity and mortality, that everybody can do it, but to look into the living circumstances of your citizens, to look into the social structure, people in different social situations, ethnic groups, lifestyles, to have a good picture, to measure inequalities. There are huge inequalities even in the most advanced countries of the world. I can show you in London, within a square mile from the famous Oxford Street and Mayfair, which is, let's say, top of the market, to King's Cross, which is an area less privileged, differences of life expectancy of the order of 12 years. That's in London. But then I go to other places and cities and they say, we don't have inequalities. But how do you know? You need to measure them. You need to be aware of the needs and the expectations of different groups. But it's not enough only to work on the underprivileged, the very poor. You have to have policies and programs that will address the needs of all the social gradient. You have to be able to address inequalities in a more comprehensive way, not to limit action on equity and then marginalized in one place of your city. It has to be a central value, this idea of building a city which is a city for all the citizens. And there are excellent examples of how this can be done. There is a question about how a political leader can do to create a city that is bike-friendly. Well, cycling lanes you can say, that are increasingly popular in many countries, and they also symbolize they symbolize something about the quality that we all want to have in our physical environment, the friendliness of the city, the easy accessibility and mobility in the city. But they come to Nordic countries, so some countries like the Netherlands, Denmark, Sweden and other countries, they see this fantastic infrastructure for cycling, and they say, well, we are not Scandinavia, we cannot do this. And I lived in Copenhagen for about 25 years because this is where the headquarters of the regional office of WHO for Europe is. And I have worked with Danish politicians and cities, and I can tell you this, cycling lanes in Denmark and in Copenhagen were not created by God on the seventh day of the creation. No, it took years and years of political debate, of a lot of addressing a lot of concerns, of course, because creating cycling lanes, it's not only expensive, but it also takes a lot of space. Where you have a road with 4 lanes, now you only have 2 lanes, one in one sense and the other in another. So this means slowing down the traffic. But there was a vision. There was a vision years ago. There was this anticipation of what is to be if our city grows and grows and grows. There will be more and more cars, and then how is it going to be? Because the Danes have a great interest in creating environments that are good for people, human cities. And then the result you can see today. 45% of people who work in Copenhagen go to work every day by bicycle. 45% in all weathers, not only in the 2 warm months of the summer. But this was a vision that was not a unisectoral vision. Cycling is good for energy, is good for the environment, is good for traffic, is good for health, it is good for conviviality. You can't imagine what the Danish will say about their cycling lanes. It's another culture. but it is a culture that has given the city has made the city more humane. It has enabled people to interact more easily. If you are there in the morning between 7 and 9 o'clock, there are thousands of bicycles around Copenhagen. Once I invited a champion of cycling, it was an urban planner, to speak to one of our conferences. It was a woman, and she said that when they surveyed women in Denmark to find out about their appreciation of cycling, concerns, and so on, many women, she mentioned, I can't remember now the percentage, said that they adored cycling because they could wear high heels and go to wearing high heels because they didn't have to work. So by cycling, it was easier to wear the shoes you wanted to wear. But it is not an intervention that it is a one-off thing. If you come to Denmark, you will see that municipalities will do regularly surveys. They want to find out who are those who don't cycle and why they don't cycle. A recent survey by the Copenhagen municipality showed that there were a number of ethnic minority groups who didn't think that cycling was something they should do. There were various explanations around that, around this survey and the results. What I felt was very important is that they made an effort. They were going out of their way to reach out to those who didn't and encourage them to cycle. So it is a huge investment by the city, as I said before. And I know some will say, oh, but our cities are not as flat as Copenhagen. They are very hilly. We cannot have those great cycling lanes because Copenhagen, the bicycles are at a different level. It's quite safe. You have the pavement, you have the level of the cycling lane, and then you have the road. So cyclists are independent. Of course, in crossing roads, you have to interact with cars, but it is a network which is absolutely fantastic, and it is very safe for all ages. So it takes a vision, it takes strong leadership. It takes a commitment to change and create environments that will be good not only for the generations of today, but also for the future. And of course, when we talk today about cities becoming carbon-free by the year 2030 or 35 and so on, leading by example, the cycling investment is, of course, a great investment. What do you think are the most critical areas for cities to put resources toward in the coming decade as they rapidly grow? Well, it depends where these cities are, but there are some challenges that relate to all cities. We all face the non-communicable diseases epidemic, and also the obesity epidemic. And I think it's a major priority for cities to make sure that we address this seriously. Obesity, especially obesity of our children. We have some countries in Europe where this is a major public health problem. Cities need to create conditions and environments that will support children and whole families to address this issue in the long term. And this, of course, is a multi-sectoral approach, from the school, the family, the environment where they live, the issues of physical activity, nutrition, and so on. Issues of equity. Cities cannot afford today not to take seriously the growing inequalities, which themselves are extremely destructive. But addressing inequalities today is even more challenging because the composition of urban populations, because of the migration flows in Europe, is a mega issue, as you probably know. They have to be even more sensitive in the way they do it. In Copenhagen, I was referring to, there are 220 languages spoken. Populations are not as uniform as they used to be before. So if you are a doctor, a planner, a social worker, an educator, you have to think and to understand where all these various groups come from and what are their expectations in a wide range of services, as I mentioned before, education, social, culture, and so on. So the issue of inequality and understanding this multi-ethnic and multicultural composition of our societies increasingly today. There are very important issues that relate to, as we said before, making the city accessible in every sense to families, to people, issues of safety and violence, and being age-friendly and child-friendly are very important. The aging of the population is a mega issue. It's not a public health problem, but it is a challenge. How do we fit, how do we adapt our cities today to a growing aging population? And older people have expectations for good life. They are fit for long periods after their retirement, and they expect the city to fulfill also their own expectations. Another issue is preparedness for public health emergencies. Today, you have it in your country very frequently with these various weather phenomena, and we will have them increasingly so. I mean, climate change creates many challenging situations which by the end of the day affect local communities. And who pays the worst price when those catastrophes hit our cities? The worse offs. So that's where the issues of inequalities, when cities are flooded, it is the worse off communities which pay the biggest price. And so when we think about preparedness, we have to think, yes, of good plans, command, control, having the means to respond quickly, but also we have to think that this has to be a response that will be also proportional and equal to and addressing with sensitivity the needs of different groups. I want to give you the example. It's something that those of you who may have heard me speaking would know. It's an example of a program I watched in the UK. It was a BBC Panorama program, but it's something which I thought was so effective when a journalist stood on top of a hill of a northern eastern city in England called Sheffield, and he did something very simple. He pointed to one part of the city and he said, the children who are going to be born in that part of the city, they are going to live longer, they are going to go to good schools, they will grow up in neighborhoods that are healthy, they will have access to greens and parks and gyms and you name it, and then later they will have good education and greater opportunities for employment, and they will live longer. And the children who are going to be born in that other part of the city, they are going to grow up in environments which are degraded, the physical environment, the services not of high quality, the schools not of high quality, and their nutrition, the whole circumstances of life will be detrimental to their health, not only at that particular time, but also will be a kind of a kind of negative determinant that will affect the rest of their lives, and they will live much less than those other children. A very effective way to think about our cities today. So these are important issues. And of course, when I spoke about the preparedness, don't forget, I'm thinking now about Europe, because of the climate change and the temperatures, we also have now diseases in the southern of Europe we didn't have before. They stopped at the north of Africa. Now they are prevalent also in many countries, European countries. So cities are uniquely placed to safeguard and promote the health of their citizens. And they need the support of their governments. There are governments that recognize that. The government in Finland gives the responsibility for health promotion fully and squarely to mayors, to local governments, because that's where it can happen. That's where community resilience can be developed and built up. That's where intersectoral partnerships can become a reality. That's where even the corporate sector can be part of platforms that share the same goal to create sustainable and livable communities. What are the first steps we can take to make US cities adopt a healthy city culture? Well, I'm glad, first of all, that you put it this way, because it is about changing the way cities understand and deal with health. So it is a cultural issue. And it is only when we as cities, city leaders, we can say, yes, we recognize health is important. For me, it's this leadership issue, having a vision for the city where health and well-being of the citizens becomes a priority, and recognizing how it connects with so many of our policies and plans for economic development, for social development, and so on. That's a very important starting point, because I have colleagues who tell me, oh, well, let's be practical. There are a lot of misunderstandings about the word being practical and being strategic. Practical, if you mean by practical that we introduce a few projects, which can be perfectly good interventions by all public health standards here and then in the city, and then say, okay, this was a great first step, and then maybe tomorrow with more resources we can add to them and so on. This is great, but to me and to the vision of a healthy city, this is not enough. Because the challenge of developing a healthy city, and as you say, a healthy city culture, means that this culture has to permeate, to become a common goal and a common aspiration for the whole of the leadership of the city. And this has implications for how the various departments, the various sectors, the various services will then consider how health and an equity lens could become almost something like an automatic response in the planning and designing and envisioning what they would like to do. This is a healthy cities culture, to think of the important values of a healthy city that I mentioned before: equity, sustainability, the right to health. I mean, the right to health, it may be something that we all instinctively agree with, but it is so often violated in so many different ways. You can see evidence of that in the treatment of migrants. I have seen it again and again in the treatment of older people, because the right to health, which is linked to fundamental human rights, it is not just the right to health services. Because yes, for the whole of the planet, a key goal of WHO is called universal health coverage, but universal health coverage, not universal health services coverage. Which means, how can we offer our people those circumstances that can protect, safeguard, and promote their health? And when the situation, when the conditions are not good for the health, how can we shield them? How can we protect them with our social policies, social protection, education, services, and so on? So this is the challenge to become, to promote a healthy city culture, is also to recognize that, unlike other times in the past, today we have also huge legitimacy through some of these global policies and plans, and most notably the Sustainable Development Goals. I know you may think, oh, but these are too remote from our reality. No, they are not remote from your reality. Your governments have signed up, have endorsed these 17 Sustainable Development Goals. And although you will see that number 3 is the one which is totally devoted to health, there is a number 11 which is totally devoted to cities. But if you look through carefully, you will see that all those goals are both highly relevant to health and to what happens in cities. Huge political legitimacy for a leader today to say, I want to implement those goals in our midst. And health is central, as many other issues that relate to poverty, to equity, to education, and so on. And this is what leadership can use today, together with appropriate capacity, because it doesn't happen because some people state that they want to do this, to fulfill those goals. And I think that the timing is right now to enhance, to strengthen the leadership role for health, equity, and sustainable development of cities. And I would like also to end this part by mentioning a seminar where I took part last week in St. Petersburg in Russia, which was devoted to city diplomacy for health and well-being. I know it may sound a little bit theoretical, but it is now recognized that the complexity of global health and the issues that relate to sustainable development and health development cannot possibly be addressed by one sector. We said that before. By one level of government, we said that before, is a multi-level of government kind of challenge. And also the issues that relate to negotiations, to getting health into different agreements, to making sure that the voice of countries, but now through diplomacy, but now also the voice of cities is effectively represented in those various platforms and global fora. Why? Because a lot of these strategies and plans that we all talk about that relate to our planet ultimately require action at a local level. So today, cities, through their networking, twinning, representation, branding, and so on, can put health much more visibly in the way they wish to present their city. Because mayor wants their city to be economically attractive to business. They want them to be a good family address, a good address to educate children, a good place to play and have fun, to have tourism. All those issues are very much connected to the idea of health. So today, mayors can be effective voices, not only within their communities, but also outside. And they should demand to be heard, because, as I said before, most of the issues that relate to the public health challenges of our time are actually delivered or are related to what happens at the local level. How did healthy cities planning change in decades you've worked at WHO? How do you think it will continue to evolve in the next decades? Great question. Healthy Cities was not launched as a static project with a set agenda and mechanisms and priorities, and then let cities develop and apply it. It was launched as a dynamic concept. It was in fact launched as a concept that would be more like a framework of important principles, like a commitment to equity, explicit, a commitment to community participation, explicit, a commitment to working across sectors, explicit, a number of priorities, but the flexibility to adapt it, to implement it within the socio-organizational context of a given city. So cities like Barcelona did not have to do it the same way Copenhagen, Stockholm, London, Athens, or cities in Eastern Europe and so on did it. But they all shared a similar approach to the fundamental values, to the fundamental approaches, and then as time evolved, as you said, of course, new priorities emerged. I mean, a great thing that happened in more or less when Healthy Cities was launched in 1988, it's the fall of the Berlin Wall. You can imagine that we started working with communities and cities in the former Eastern Europe at a time where they were undergoing mega changes. And of course, even the meaning of a number of terms that we were using resonated differently in different societies. I remember we organized in 1989 a conference in Hungary, and the theme was community participation. Well, community participation as it was understood there and as it was understood in other parts of Europe differed widely. And this is very common in public health and in other sciences, I'm sure, that the same term changes over time, and it is affected by the context, by the evolution of science and the accumulation of evidence. So when we spoke about equity in the 80s, it's not the same way we understand equity in the 2010s. And so this is how healthy cities have evolved. On the one hand, there was this dynamic evolution of its principles as they were applied in societies that were evolving themselves and quite rapidly. Second, it embraced along those periods whatever was important globally. So in 1992, we had the Rio Declaration for Sustainable Development. Of course, healthy cities embraced that agenda, and sustainable development became one of its main priorities. And you may recall there was also a local expression of that sustainable agenda that was called Agenda 21. And as the evidence on issues such as the social determinants of health, healthy cities launched as a network, the social determinants, the solid facts in 1998, it was the first network that actually took the evidence from science, converted it into a publication that was meant for city leaders, but also other national leaders, and began to experiment, and I would say began to struggle with the understanding and the implementation of upstream approaches to public health, because until then it was mostly interventions that were more proximal, more close to not the causes of the causes, as we say, in the language of the determinants of health, but they were mostly addressing the issues that were immediate within the health sector and the environment, mainly sectors. So, healthy cities, if you see its initial declaration, you will recognize the principles and the approach. But if you look at its content today, of course it has been enriched tremendously by three things: experience after all these years and adaptations, new evidence that has accumulated from science, and thirdly, global movements. I mean, healthy cities today, I mean, if you read this document, which is Healthier and Happier Cities for All, the Copenhagen Consensus of Mayors, which is the document, the political, if you like, declaration for the next 5 years of healthy cities. Of course, it's designed around the Sustainable Development Goals agenda. You cannot ignore that agenda. And I have to also emphasize here, ending my answer to this question, that those who are champions and leaders of healthy cities, they should not do this in isolation of what else is happening in the city. They will have to connect and work with other agendas. They have to link up. It is not a healthy cities coordinator today, who, by the way, can be a doctor, can be a social worker, can be a planner. Do you know that in Europe, the healthy cities offices in many cities are based in urban planning departments and not in health departments? The ideal city for a place for a healthy cities program in a city is to be as closely as possible to the mayor, to be close to where strategic decisions are made. It can be physically anywhere in a municipality building, but it's important to operate as a catalyst, as a convener, as a driving force for change, not to be a little project somewhere in a corner of the municipality. It doesn't work like that. That's why also to be a good champion in your city, to be someone who makes friends, not enemies, someone who connects, who begins and enables dialogue with different groups, is essential for the success and the introduction, as you put it before, of a healthy cities culture. So now maybe I would like also to mention the examples of some cities in Europe that have actually not only, let's say, devoted, they became passionate devotees to the healthy cities idea, but they used the healthy cities also as an entry point to develop partnerships with other cities and to promote this culture for well-being and equity that they wouldn't have done otherwise. I should add that this year, back in October, we celebrated 30 years since the Healthy Cities project was launched. In Europe, there are about 1,500 cities that are members of Healthy Cities. There are Healthy Cities network in the Americas, in North America, in South America. There are big networks in most of the countries. There are Healthy Cities networks in the Arab countries, in the Eastern Mediterranean region. There are Healthy Cities in the Western Pacific, very strong in South Korea, in Australia, in Japan. In China is an emerging initiative which has attracted a lot of interest, and in Africa and so on. In every region of WHO today you will find initiatives. They are not all the same, and they are always adapted to, as I said before, to different contexts. For example, there are Healthy Islands initiatives in the Western Pacific, where there are so many states, island states. So it's another approach. But as I said before, they all share a common agenda, a common understanding of the priorities. What I always say and that was probably my main conclusion at the opening of the 30 years of Healthy Cities conference, was this. Yes, Healthy Cities brand is very respectable. It is a brand, and it is a concept that it is very attractive to politicians. Many boast their Healthy Cities logos and activities for many years. But my main point was, don't waste a great concept by doing trivial things. If you want to embrace this concept, do it, but in order to address the difficult issues, where you will really have to break barriers and silos, where you will have to build bridges with corporate sector, with communities, where you will have to build partnerships with other cities towards national agendas, but do it for the big issues, to create, to promote equity, to promote community resilience, to address issues of preparedness and climate change, to address some of the big public health issues which relate to the determinants of health. So that addressing introducing the idea of healthy public policies is not only doing health impact assessments. That's a small part of what you can do with a great concept such as healthy in all policies. And this is what I meant before. Today we have the experience, we have the evidence, we know what are the priorities, we have the know-how, and we have a great legitimacy because of these global movements, and especially the Sustainable Development Goals agenda. For these reasons, I think every city leader today can adopt and can introduce a Healthy Cities agenda as a way, as a platform, and as a catalyst, and as a mechanism to promote sustainable development, well-being, and to basically shape visions for the future which are more citizen-centric, where communities are more empowered, where the issues of public health and healthy choices, the easy choices, and health integrated in urban planning and the activities of different sectors can be easier, because they, through their leadership, they will demand this to happen, and they will hold accountable those who fail to address those priorities. I hope this has given you a feel of the work that we have been doing. I hope you will find ways to approach and proselytize your leaders in your cities. These are initiatives, because they are political in nature, that can be really powerful, but they take time and a lot of energy. But they can deliver great dividends. It was a pleasure to be with you. Thank you.